Good evening, fellow classmates. My patient scenario, I have a patient in the acute rehabilitation facility in a hospital. They have hemoptosis as well as an altered mental state. So I'm going to go straight into the PPE associated with that. Because of the hemoptosis, we're looking at a droplet precaution. So associated with that is going to be a gown, gloves, a surgical mask, and then I'm going to include a face shield in this scenario as well. Mainly because with an altered mental state, there could be confusion, could lead to anger. We just want to avoid being spit on the whole 9 yards. So I'm going to go ahead and get started putting on the PPE. We're going to start with the gown. So we've got that here. And this is all being performed outside of the room, the patient's room. My hands are washed prior. So bear with me as I get this on. Give me a minute. Okay, now that we have that on, we're going to go straight into the surgical mask. So this is going to go just like so, right behind the ears, strapped to the nose. And then at this point, we'd like to put the face shield on, but because we don't have that, nor do we have goggles available, we're just going to move straight into the gloves. But take note that this is when we put the face shield on. So last but not least, we're going to throw these gloves on. So as we're getting these on, we want to make sure that we're putting the sleeve underneath the glove to avoid contamination, as well as the other glove. Just like so. So at this point, we're ready for our patient. We can go in and do what we need to do. But as we're leaving, the nurse asked us to put the patient in a chair, make sure they're comfortable, and then we're supposed to expose the anterior left thorax. So what I'm going to do is have my patient take a seat, but before I do that, I'm going to have this sheet down just like so. And the reason why we're doing that is to avoid contamination of the patient on the surface. So patient, if you could go ahead and take a seat. Great, and at this point what we're looking for is to have the hips butted up against the back of the chair. We're looking for correct flexion of both the hips and the knees, about 90 degrees unless otherwise told so. And then we're also looking for patient comfortability. So what I want to do is take this pillow, put it right on her lap. There are other methods we could do. We could take multiple pillows, put it underneath her arms, and that's for long-term sitting. Right now we have her positioned for short-term. And then what we can also do is take a lumbar pillow if they're feeling any discomfort. Put it right behind their backs, just like so. And then last but not least, we could also add a step stool underneath their feet if they're feeling uncomfortable, or if we need to get them out of extension of either the hips or the knees. So now that we've gone over the positioning, we're going to move straight into the draping techniques. So what I've got over here is just a couple of towels. The first one we're going to do is place one just like so. And then next, I'm going to come from the right shoulder, tucking behind. And we're going to go all the way to the left hip. Just like so, in case you can lift that arm for me. Great, again, making sure to tuck. And then last but not least, I'm gonna throw one more. Patient, if you could lift both your arms for me. We're just gonna go across the abdomen, just like so. Making sure to tuck on both sides. Just like that. And then at this point, we can go ahead and remove the gown. Bring the patient's arm up. So as you can see, we can either access the thorax from the anterior lateral side, or come straight from the front, bring the gown down, and get to the thorax from there. So the last thing we're going to do is doff your PPE. So we're going to start with our gloves, making sure not to contaminate. So we'll take one glove off, and we'll come underneath, take the other one off. And then we will go face shield, which we don't have right now. So we'll go surgical mask. Just going to come off just like so, making sure not to touch any of the outside contaminated area. And last but not least, we're going to doff our gown. So it's going to come off just like so. Taking the front part off, you can come into the inside, pull out, the other side, pull out, and then scrunch from the inside, making sure not to touch any of the contaminated outside.